This class is on anterior teeth arrangement and selection of anterior teeth for construction in complete denture. This topic is important because it is an area of prosthodontics where art dominates science, where aesthetics is the major concern, and where knowledge must be applied to create a pleasing appearance while simultaneously maintaining oral function. Coming on to the selection criteria, the artificial anterior teeth must be of proper shape, must be of proper dimension, must be of appropriate color, and must be easy to fabricate and adjust. And coming on to the selection of the anterior teeth, there are three things which are important: size of the anterior teeth, shape of the anterior teeth, and color of the anterior teeth. Now coming on to the various elements which can be used for selection of size of anterior teeth. Under that, first we have pre-extraction records. In pre-extraction records, the first thing that we have is the dental cast. With the dental cast, we can use vernier caliper and estimate the size of the anterior teeth. The second thing that we have is pre-extracted tooth, that is the extracted tooth. This extracted tooth, that if the dentist preserves the extracted tooth, that size can be used for selection of artificial anterior teeth. The next thing that we can have is the facial photographs. The photographs of the patients can be obtained so that that image can be used for selection of anterior teeth. The same way, the photographs can also be used for selection of anterior teeth in correspondence with the other anatomical landmarks, like the length or width of the tooth on the patient is equal to the interpupillary distance on the patient by the interpupillary distance on the photo multiplied by the length or width of the tooth on the photo. Even pre-extraction radiographs can be used as an element for determination of correct size of artificial anterior teeth. Family photographs can be used in situations the patient is comfortable when selecting the teeth size from their relatives. Now coming on to the other method, which is called as anthropological measurements, there are various facial or body measurements which are used as reference landmarks for selection of anterior teeth. Under that, first we have is Sears cephalic index. Sears cephalic index uses a flexible ruler in which the width of the maxillary anterior teeth is equal to the circumference of the head divided by 13. The next anthropometric measurement is the bizygomatic width. When bizygomatic width is divided by 3.36, it gives the width of maxillary central incisor. Pound's formula is nothing but the bizygomatic width divided by 16 or the length of the face divided by 16 for estimation of the anterior teeth size. The anterior teeth size can also be used with the help of measurement of the inter-alar distance. If you take the measurement of the inter-alar distance, it gives you the measurements of the 6 maxillary anterior teeth. The intercanthal distance is another thing which can also be used. The third thing which can be used is the intercommissural width. Intercommissural width, when it is marked on the occlusal rims, we can take a flexible ruler and take the measurement, and that can be used for estimation of the size of the maxillary anterior teeth. The next thing is the measurement from the incisive papilla to the maxillary tuberosity. It forms a triangle, and then that measurement can be used with the help of your flexible ruler for estimation of size of all the upper teeth, both anterior and posterior. Then coming on to the size of the teeth. Size of the teeth can also be estimated with the help of photographs or with the help of CPC line. CPC line is nothing but canine papilla canine lines. This is used for estimation of the 6 maxillary anterior teeth. The next thing is length of the tooth. Length of the tooth is determined with the help of the facial form. This classification was given by Leon Williams. It is called as Leon Williams facial form classification. According to this, the inverse of the facial form, which can be either tapered or long, square or square shaped form, or ovoid. Now based on the shape of the facial form, when we inverse it, the shape of the maxillary central incisor is obtained, is what Leon Williams recommended. The next thing that can be used is true bite tooth indicator. 2 by tooth indicator is a graphical silhouette which is used as a template placed over the patient's face, and measurement, it has various graphical measurements which can be used for correlating the size of the anterior teeth.